Now, just to know and have a better understanding of the condition of dementia, we must be well versed with the anatomical features which are related to this condition or the development of this condition. Now, you all must know regarding the basic structure of the cerebral cortex. It is basically thrown into folds, which are known as sulci or gyri. They are basically the foldings that are present in the cerebral cortex. Now, there are the functional organizations that you must remember when you're looking at a cerebral cortex in an individual, and you must know that each gyri is responsible and it has basically the functionality of its own. For instance, we have divided, for our own ease, we have divided the cerebral cortex into different functional zones. And we have basically given numbers to these zones. For instance, we have the motor cortical areas, we have the primary motor cortex, we have the secondary motor cortex, and we have even numbered these areas accordingly just for our own reference. Now, apart from this motor cortical areas that can be affected in case of dementia, we must know that dementia is basically a condition which develops due to the degeneration of the cortical region. So it is basically this shrinking of the cortical region that is resulting in a kind of memory loss. That is basically whenever it is going to affect the hippocampal region, amygdala, and these are basically the regions responsible for the memory-making process. Amygdala and hippocampus, these are the two major regions that are responsible for the development of memory. Then if the language is affected, it can be two areas that were involved. It can be the Broca's area, which is basically the motor area for speech. If the Broca's area is affected in an individual, what will happen is that he or she is going to comprehend the speech, but will not be able to vocalize his or her own thoughts. So that is how the clinical representation would be. On the other hand, if we have the Wernicke's area, which is again a speech area, but it is basically, if it is affected, then the comprehension of the speech of the individual is going to be affected. He or she is going to utter words which have no meanings. So it's going to be an incomprehensible speech that is generated by the individual. So this is the difference, and different areas are again responsible, and that is why people who are suffering from dementia show a variety of clinical picture, because all of these cortical regions can be involved. It can be the motor region, it can be the languages that are affected, the language areas are sometimes affected, and sometimes it is also coupled up with the hippocampus and the amygdala, which is also being degenerative. Now, when we look at the CT scans and the MRIs, what are we going to find? Again, it is going to depend upon the underlying causative factor. As I've mentioned, there is a range of etiological factors out there, ranging from infectious conditions, traumatizing conditions. It can be tumorous conditions, benign, or either the cancerous conditions metastasizing from the distant areas, or it can be even the simple degenerative conditions such as Alzheimer's disease. So when we compare, even when we look at this diagrammatical representation, you compare a healthy brain with a brain which is suffering from Alzheimer's disease, you're going to just have a look at the fact that there is a cortical atrophy. And due to this cortical atrophy, there is an enlargement of the ventricles that is noted down over here. These spaces are known as the ventricles in between. We have a third, a fourth ventricle, and all of these ventricular spaces are basically enhanced in cases of cortical atrophy. So this is what you're going to basically look for when even you are looking at the MRIs or the CT scans in these particular patients, and you're diagnosing that this patient is suffering from dementia. you would be even giving a definitive diagnosis. Why is this dementia developing in this particular patient? Either it is Alzheimer's disease, either it is Creutzfeldt-Jakob disease, or the patient is suffering from some sort of a frontotemporal degeneration, or either these are the age-related degenerative conditions that are developing in the patient. Whatever the cause is, you are going to move on towards the definitive cause, because that is how you're going to manage the patient accordingly. And knowing this is very important for you. As a physician and obviously as a clinician, you must be well versed with these anatomical areas. And even the cerebellum is involved in the basically having the memory images, and that is why the memory pathways are generated through the cerebellum as well. Sometimes when the cerebellum is affected, the gait or the way the person walks is also affected. So all of these areas have their significance, and you must know this functional anatomy just to treat the patients in a proper way and manage the patients accordingly.